booster shots for all adults in the U.S. could soon become a reality. Sources say the FDA will likely bypass outside vaccine advisors when it's considering to authorize Pfizer's COVID booster shots for those who are older than 18. Pfizer applied for emergency use authorization earlier this week, but if it passes, the CDC will still need to sign off on it. California and Colorado are already taking an extra step in directing healthcare providers to give boosters to any adult who asks for one. In the meantime, almost 1 million children, 12 and younger, have now been vaccinated against COVID. It's been 2 weeks since the FDA authorized Pfizer vaccines for children between the ages of 5 and 11. Dr. Frita Fisher specializes in internal medicine and pediatric medicine. She has a new book coming out soon titled Under Pressure, a guide to controlling high blood pressure. Doctor, thank you for joining us from Atlanta this morning. You know, we talked a little bit about the White House announced new investments in COVID testing this week. We know vaccines are ramping up, but how important is it that we continue to expand testing?
Good morning, Elizabeth. It is so important because now, especially with the holidays, we know that families are excited to be getting together. They're going to be close. They're going to be shoulder to shoulder. They're going to be breathing in each other's air, many times without masks. And so in order to do it safely, as safe as possible, testing is important. And it's really wonderful now that we have home tests, we have rapid tests. You can actually purchase these tests, and you can even have them as a housewarming gift to guests. You ask them to get tested before they get there. You certainly should recommend that your guests be vaccinated, and they can test before they get to your home. They can test again with a rapid test once they get there. If they're symptomatic, you certainly want to keep them away from the family gathering. And still, especially if they're immunocompromised people, if they're elderly people, you still want to wear masks indoors. So,
you know, you talked about the holidays. I mean, that it's so fast approaching with people gathering together. Perhaps some people have waited almost 2 years to see each other. So what would you be telling patients? How do you gather safely? Because there are some people who don't want to get vaccinated, and then there are still children who are under 5, or maybe parents who are hesitant.
Absolutely. And so I absolutely recommend, now that the evidence is so overwhelming, the only way that we're going to really contain this pandemic is to have most people vaccinated. And so again, I recommend that people get vaccinated, and if they're eligible, get the booster. I myself have been triple vaccinated at this point. I've had the booster. I recommend that others do the same. As far as children, if your child is 5 to 11, if your child is 5 and over, I recommend the vaccinations. We've shown that they are safe and they are effective. And again, for those who are immunocompromised, you still want to wear a mask.
You know, when I was reading a little bit about all the work that you've done, and I read about the book that's coming out soon, Under Pressure, a guide to controlling high blood pressure, why is it important that we know the side effects of the vaccine, but especially with long haulers, we don't know the side effects of the actual virus?
Well, you know, it's dynamic. Science is dynamic. As we make our observations, we continue to learn. We already know that so many people who have COVID-19, the disease, even if they survive, there are consequences other than death. With the long haul, we know that there's respiratory problems, there's cognitive or thinking issues, there can even be circulation problems. I have patients on dialysis now because of long haul. And so we know very well that COVID-19 has devastating effects, and we definitely know that the vaccination's benefits far outweigh any unknown risks.
All right, Dr. Frita Fisher, so well said, and we know that this is something that you're an expert at, so we appreciate it.
Thank you.